Today, we're honored to spotlight Dr. Nwando Olayiwola, an experienced and transformational primary care physician, healthcare executive with a distinguished track record of leadership across community health, academic medicine, private practice, managed care, and corporate healthcare environments. So, as I just discussed, you've been a force in transforming healthcare systems with a focus on community engagement and healthcare innovation. So tell me, what personal experiences have shaped your path into this work? Why do you do what you do?
Yeah. Well, first of all, thank you so much for all you do. I'm really glad to be here chatting with you. I think it's good for me to start at the beginning. Kind of how did I end up doing the work that I'm so passionate about? And I like to really always pay homage in these conversations to my parents and their journey as immigrants from Nigeria to the United States was one where uh, it occurred after the Nigerian Biafran Civil War in the late 60s and led to lots of decimation of the universities that they were attending and lots of other universities across Nigeria. But what that did was inspire this incredible hunger in them to seek a better life, but also to use education as a tool. So in my youth, I got a chance to spend some time with my aunt who was back in Nigeria, my maternal aunt who was a doctor, and she was for what you would describe it now would be like a general practitioner, kind of local village doctor. And she used to go to visit people around our village and she would come. She was trained in the UK. She came back to Nigeria. She would come and she would go to people's houses. And I remember my older brother and I being with her a couple times, and we'd see her. And every time she would go places, people would be so excited. They would be like rolling out the red carpet. They'd be bringing treats for her and for us. And then I started to see that being in clinical environments, seeing when my grandmother came to the United States, didn't speak English, how she was treated in healthcare, just feeling like I wanna be this thing, but sometimes this thing doesn't necessarily work for people, of all backgrounds, and, it gave me a lot of inspiration to start to go into healthcare, but particularly into healthcare where I'd be able to influence people who were sometimes on the fringes of care.
No, I'd love to look at that because you've talked a little bit about the fringes of care, and then you entered sort of an industry. I mean, what are some of the opportunities? I know there are challenges in making it more inclusive, right? In making it accessible to all, but also kind of within the industry, so that all kinds of leaders and healthcare leaders are available.
Yeah, you know, we healthcare is really complicated. I mean, I think when you're going through medical school for me, or nursing school or pharmacy school, whatever health profession you choose, you're so focused on learning the the science. What I think happens when you start to actually take that clinical biological learning and put that in the life of real people is that it becomes really hard because things don't necessarily make sense. A pathogen that you learn behaves this way could do something very different because a person has, emphysema or they've got heart disease, or this person uh, lives in a rural community where they don't really have access to a pharmacy and they can't consistently get that medication refilled. Or they've got challenges with getting food and they cannot eat. And they don't have the right sustenance that will help even enable that medication to do what it's supposed to do. And so you start to learn that there are all these complexities around it, and for some that's really hard. But now, you fast forward a bunch of years, and we're understanding that we
Yes.
can't get very far if we don't think about how all of these things are connected and really engage with communities and people and think about healthcare beyond that immediate clinical diagnosis.
And of course, now it's 2025. So the part of that is the role technology plays. Like we talked about you being in the intersection of technology. Give us an
Yeah.
example or give us your thoughts. I mean, is that helping in creating more equitable
Yeah.
healthcare?
I think so. I mean, I don't think that technology solves all problems. You've got to be really thoughtful in how you deploy technology and be really thoughtful in who has access to the technology that you're using to catalyze changes in healthcare. But I think it can be a really, really powerful tool. And I'll give you one example that from earlier in my career that has really been very essential in my thinking around the way we can leverage technology. So, very early on in my career, I was working in the community health center space at a federally qualified health center called Community Health Center Inc. in Connecticut. And we had this tremendous problem with like largely underserved patients, many uninsured or people who were on Medicaid or Medicare, very little commercial insurance. So our patients would have such a hard time getting access to specialty care. We would refer, let's say, a patient to go to get orthopedic care or cardiology care or dermatology care, and we would get some of these practices would say, well, we only see X% of our patients are have Medicaid, or X% we will allow that are self-pay or uninsured entirely. So you would be fighting for these like 2 or 3 slots that your patients could potentially get. And meanwhile, every other community health center is also trying to get their patients into those slots for charity work. Or they would say, okay, yeah, we can see your patient for this orthopedic injury. We can see them in 18 months. And that's literally the kind of stuff that we would get. So it's like, there's no way that this is sustainable or even healthy or fair to our patients. So there was a model that had emerged in San Francisco called electronic consults, where they would keep the patient in the primary care space since they had the ability to see them, and electronically have the primary care physician consult with a specialty care physician and do the consult that way. What that did, we implemented that in Connecticut. We're the first ones to do that in the state of Connecticut, with in partnership with the University of Connecticut. And what that did was it uses a very simple technology platform that created access. We found that like almost 70% of the referrals that the primary care docs were making to the specialist didn't actually need to be seen by the specialist. They could be seen and managed by the
Mm,
primary
mhm,
care
mhm.
physician with guidance and everything from the specialty care person. And then the patient didn't also have to travel
Yep,
to the specialist, because sometimes they'd have to go
yep.
on 3 buses to get to some of these specialists 6 months later, right? And so the patient could save some of their time. They would not have to miss a day of work, which could mean literally a day's wages lost. And we could get the care for them. And then what by reducing that bottleneck, you could also get more patients that really needed to be seen into the
Love that.
specialist. So I think that's a really good example of like how technology can enable access to care for again those folks that are sometimes on the fringes, and be leveraged in a way that's really meaningful, that offers dignity for folks and allows
Absolutely.
them to continue with the work and the life that they have.
I love that, which is our last question. So we this is the Action for Impact Summit. We have a
Yes.
broad audience. We've got business leaders, we've got individuals, business owners. What is your call to action? What do you want to see the audience do? What can we do?
Yeah. You know, there's a lot. I think it's great that you assemble this group to interact with folks from different backgrounds and different experiences. The one thing that I think is probably a common thread that I leave people with, and I've said this in a few conversations that people have seen me on, and I believe it very strongly, and I try to live it every day, especially as I've grown and grown and risen and to kind of that top of that pyramid as I described. I think it's really important for women leaders in particular, and I say this: when you kind of ascend to where you're going, you get to that senior role. I say all the time to send the elevator back down. Be willing to invest in folks that might not be able to ascend the way you did, or give them a chance to ascend the way you did. And there's because you'll find that it's lonely at the top, and so when you get to the top, if you help the people get up there with you, then you'll have a good crew of people that you're working with when you get to the top. So
Well, that's the thread. It sounds like
that's
with
my
your advice, well, it sounds like your whole career, it's sort of building the community, building the impact, starting with the family up to it's lonely at the top, send the elevator back down. Which thank you, Dr. Libola, because this is, as you know, part of what Women Business Collaborative does. As a collaborative, we believe we're faster together. And we believe
yeah.
that by working together, we can really spread equitable opportunities from healthcare to the business sector together. And as a leader, we appreciate your expertise, appreciate your time, and thank you for your words of wisdom.
Oh, thank you. Thank you for all you do. It's really an honor to be here.
Thank you.